Let me share my presentation. So in this presentation, let me see how I started. Oh, like this, I think. Yes. Okay, so in this presentation, I will try to give you an update on the latest developments in the EIOS system, in particular related to social listening. So first, some general context. So one of the main strategic objectives for WHO is to ensure global health security. And with EIOS, we try to contribute to that by trying to detect and respond to health threats as early and quickly as possible. And that way, hopefully save lives and minimize the impact on society. And in fact, our ambition is in the end to be able to detect and respond to health threats so early and so quickly that they have zero impact on people's lives. And of course, we are still not quite there yet, but that is our ultimate goal. And also, we have a full mandate from the member states to perform this task. In 2017, WHO accepted to lead this EIOS effort as mandated by the member states. Okay, coming to perform this, to describe this process of detection, verification, and risk assessment. To give an idea, on the left-hand side, you see the different steps in this process. So starting on the top, going clockwise, initially you may have an indication of a possible new event or signal, which maybe in the beginning you're not quite sure yet what it is or if it is really a new event. So you start by trying to identify and get more information about it. And then when you are more or less, when you know more about the type of event you're looking at, you want to verify it. You want to confirm that it is really a new event or a new hazard to health. So if, for example, you can perform sample tests and see if the results from the test come back positive, and to confirm that there is really a new outbreak, for example. And once you have that confirmation, you want to respond to that. For example, you want to provide actionable insights to the local authorities or field experts. And now the approach that we choose in EIOS is what we call the all hazards, one health approach. So all hazards in the sense that we want to detect not only disease outbreaks, but in fact we want to monitor all different hazards that can affect human health. For example, we also consider natural disasters, man-made disasters or conflicts, anything that poses a threat to human health. And we look at one health in the sense that we look not only at human health, but also at animal health and environmental health, because those can indirectly also affect human health. For example, we know many infectious diseases start by circulating in animals and then at one point can jump to humans. Okay, now coming to the EIOS system. So as the name suggests, we perform our task by analyzing data from open sources, publicly available data, for example, news media websites. And now, of course, there is no lack of data volume, but there's a lot of low quality data and disinformation, which we would like to at least be able to separate from the useful data. And on the other hand, there is also data which we know would be very useful for us, but which we are not allowed to access because it's not publicly available. In particular, patient data in hospitals would be very useful for us, but we cannot access that yet, at least not with our current methods. We are studying ways to still be able to analyze that data even without having direct access. But for now, we can only look at publicly available data. Like I said, news media websites, but we are also starting since last year to look at social media like Twitter and Facebook. Now, this is what the public health intelligence landscape more or less looks like. So EIOS is not the only system. There are also other ones like GFIN, the Global Public Health Intelligence Network by Canada, EMN, the European Media Monitoring System by the European Commission. They are all different in many ways, so they all complement each other. And we want not only to work on the EIOS system itself, but also to be able to connect all these different systems to strengthen the public health intelligence function. At the moment, we do that by importing the articles from these other systems, treat them as an additional source for our system. But actually, this is not yet ideal. It is not enough to put all this data in a single place, because to get insights from all this data, you need to have not only the data elements themselves, but you also need to understand the relationships between these data elements coming from different sources. And so for that purpose, we are also working towards building this network that you see illustrated in the background of this slide. That will allow us to also have the relationships between the data elements and then allow us to put the data in the proper context. Okay, now here you see what the EIOS system looks like for the user interface that we provide to the analysts. On the left-hand side in the screenshot, you see the time chart with the rate of articles coming into the system. As you can see, we clearly have a period before and after the outbreak of the coronavirus. After the outbreak, in the end, we had the rate of articles coming into the system increased by about 6 times compared to the period before the pandemic. And of course, that poses all kinds of challenges for the system, but also for the analysts who it turned out in practice, in many cases, they were no longer able to perform their task of scanning all these articles by hand and looking for new events because there were just too many articles. And on the right-hand side, you see the list of articles that pass the filters that are configured by the analysts. On the left-hand side, below the time charts, are the different filters that the user can configure. And on the slide, you see some statistics, just to give an idea how many of the amount of data we are analyzing. Okay, like I said, the analysts are struggling to deal with the massive amount of data that we are now getting since the start of the pandemic last year. And one of the tools we are now testing and developing since last year to hopefully assist the analysts and reduce and to make their work more manageable by reducing their workload is this algorithm that can predict if an article is likely to be credible or not. By analyzing the style and the tone, the way the article is written. You see in the animation and the information exposed from the algorithm in the user interface in the test environment for our system. You see on the top, you see an overall score between 0 and 100%. And also in more detail, the algorithm tries to assign the article to one of these classes that you see. We have about 10 classes in total, like misinformation, propaganda, hate news. And this way we hope to help the user by being able to filter out this disinformation in the first place from their analysis. But another use case we have for this is that the user is then able to follow the spread of this misinformation over time and detect outbreaks of misinformation. Okay, the last new development that I would like to share with you, this we exposed to our users not long ago, earlier this year, the Twitter dashboard, where since about 1 year we are importing tweets from Twitter filtered for the coronavirus category, the same definition that we use for the main EIOS system. And in this dashboard, the user can then apply various filters and also perform free text search. So you can, for example, perform sentiment analysis by, if you want to know, for example, what people are tweeting and discussing about side effects of corona vaccines, you can enter a few keywords in the free text search and you find the most popular tweets. And you can also navigate to as you can see, you can navigate to the original tweets that are the most popular ones that have the most retweets. And then on this last slide, you just see the same Twitter dashboard, but you see the different filters that people can apply. You can filter by country, by language, etc. And you also see the distribution across the map of all these different tweets. Okay, thank you. That is what I would like to share with you today.